Good morning. My name is Terry Randolph, and today we're going to go over computers in the medical office. And more specifically, we're going to focus on the medical billing cycle. The objectives for this particular live lecture, we're going to cover very specific key terms as it relates to healthcare. We're going to also talk about the things you need to collect from the patient in the pre registration process and the financial responsibility component of that. And we're going to go over the overall billing cycle process. Here are some of the key terms we're going to talk about and the differences between those terms. I won't go over all the terms, but I will touch base on a few of these. Coinsurance is something that is percentage wise, and what happens is that the patient pays a percentage and the employer or patient pays a percentage. Coinsurances can range from 90-10, 80-20, 70-30. You oftentimes probably see more of a 70-30, 80-10 plan, but what that means is that the employer in the 90-10 plan, the employer would pay 90% and you, the patient, will pay 10%. So coinsurances are always in percentages. Copayment, you all probably have because they don't really have any insurances anymore who do not have a copayment. But with a copayment, you pay that at the time of visit. It usually ranges anywhere from $15 to about $40. And some of you have various copays depending on what kind of provider you're going to see. If you're going to see a family practitioner versus going to see a specialist versus going to the ER and you're not admitted. So those amounts can vary, but the copayment is something you want to take care of at the beginning of your visit. A deductible is something that a patient or a guarantor or policyholder has to pay for before services are being paid for by the insurance carrier. More frequently, you probably see a 5,000 deductible, which means some of your services rendered when you're going to see a provider, some of those services will be applied towards your deductible. When those services are applied towards your deductible, that is the out of pocket portion you pay. And you have to keep paying a certain out of pocket portion until you've met your deductible. Once you have met your deductible, the insurance will pick up the remaining portion of your balances on any treatment you received. And your deductible actually renews every time your insurance renews. The average employer insurance renews during their fiscal year, which is usually their calendar year, which renews every January, but occasionally you'll have an employer whose insurance plans will renew June, July, October, whenever their fiscal year renews. This screen covers the medical billing cycle. And as you can see in this particular picture to the right, there are 9 particular items that I'm going to cover with you as we go over the medical billing cycle. The first component is pre-registration. And what people need to realize is that pre-registration is very important. When a patient calls to schedule their appointment, the first thing you'll definitely want to do is make sure you obtain all their demographics, but you also want to find out who the guarantor or policyholder is, and you want to get as much information off of that insurance card as you can. The reason for that is for you to verify that the insurance is effective and potentially what the patient's out-of-pocket cost is going to be, and are you an in-network provider? Are these services going to be rendered? And the patient likes to know how much they're going to be having to owe out of pocket. So it's definitely good to make sure you have all that ready to go before the patient gets there. And it really helps on long waiting times in the lobby. When the patient gets to the office, they're going to check in, they're going to check out. Depending on the practice, you're going to find out when the copay is due, or some providers now are taking a portion of deductibles and co-insurance up front. So however your provider works that out, once they find from the insurance company what they think your estimated out-of-pocket cost is going to be, they could potentially take some of that money up front and put that on hold on your account, and after insurance has made a determination or a payment, they will give you any overages back. When you're done being seen, your provider usually gives you a slip to take to the checkout, and it usually has a lot of codes. You probably don't understand what those items are. It usually has a CPT and an ICD code. The CPT is the procedure, the ICD is the diagnosis. They check that off. So the procedure is what the doctor performed on you or did for you that day, and the diagnosis is what is wrong with you, whether the provider determined is the issue with your health for the particular day. After you check out, someone will put these charges or your visit into the system. That is for them to submit that claim electronically or paper for those places who still do paper claims to the insurance carrier to determine how much is going to be paid on your claim. So the claim does go to the insurance carrier and they do something, a process called adjudication. Adjudication is when the insurance carrier is going to process that claim. When they have finished processing that claim, then at that point what they're going to do, they are going to make a determination. They're going to send you something referred to as an EOB, and that means explanation of benefits, and you probably all receive them in the mail. The explanation of benefits is going to go over what you were seeing for, who you were seeing, how much was paid, how much you owe, how much has been applied to your deductible, your core insurance, your copay, how much is written off to contractual adjustment, that sort of thing. When it gets back to the provider, they're going to post the payment, and if there's any outstanding balance that the patient owes at this given time, statements will be sent to the patient. This is going to show up on what is called an AR follow-up report, and this is whether it's insurance or self-pay patients. This is any outstanding balances that is on a patient account for any date of service. You always want to keep in mind, you want to keep your outstanding claims under 121 days, but this is what people do to follow up on any claims, whether it's an insurance carrier and you're checking to make sure they receive the claim and what's the status of it and if they're going to process it, or with a patient who's self-pay and working with them on that bill. If a patient does have a bill they don't pay, oftentimes we forward them to collections. Collections does get a portion of that bill. There's also something referred to as bad debt, and a lot of providers will write things off to bad debt, or they have so much money a year allocated to bad debt for those patients who decide not to pay their bill. And what happens if you do change your mind and you do pay your bill, they reverse the bad debt off and post your payment. So there's also something called denial management. This is what happens when your claim is denied for whatever reason. Sometimes it's denied for reasons of the provider's office, like submitted to the improper claim location or improper insurance company, incorrect policy number, group number. Maybe this insurance is canceled, patient has a new insurance. It could be something like they need medical notes or radiology notes or lab work, or need to know why the procedure was performed. Sometimes it's because they need the prior authorization or the referral attached. So when you get a denial, it can be for various reasons. It can be a provider, some of his numbers issue, his NPI, that sort of tax ID issue. So whatever the denial is, try to work it as soon as possible so you can get that claim processed and get it paid. There are various reporting levels in the medical billing cycle, and I just want to go over those few things with you. In summary, I just want you to know that claims are a very important part of the healthcare process. It ensures financial stability for your facility. It is always wise to gather what you can before the patient's visit or during their visit, so you can collect as much as you can in regards to that patient and try to submit a claim that's clean. And by submitting a clean claim, that means you can get reimbursement or determination quickly. I truly have enjoyed having you all here, and I hope you all take care and have a great day. Bye-bye.